Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment, showcasing innovative strategies, success stories, and fresh perspectives that impact the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Workforce Wisdom, Recruitment with Purpose, Tina Holt's journey in building stronger healthcare teams. Welcome, Tina.
Hello.
It's good to see you. For our guest, Tina brings over 22 years of leadership experience in healthcare with a strong focus on business development and physician recruitment. She holds a bachelor's degree in management and human resources with an emphasis on healthcare administration and radiation therapy. Tina has built a career defined by her entrepreneurial mindset, strategic vision, and deep commitment to building strong, sustainable teams. With a diverse background spanning imaging services, physician relations, and senior leadership, she's known for her ability to lead by example, motivate teams, and align people with a purpose. Her passion lies in not just filling roles, but in building lasting relationships with providers, communities, and healthcare organizations alike. Welcome again.
Thank you. I'm happy to be here.
Tina, you've had a fascinating journey in healthcare recruitment and throughout your career. Can you tell us what initially drew you into recruitment with some of your other imaging background and leadership roles, and what really has kept you enthusiastic about it all these years?
So I was working as the imaging director at a LifePoint hospital. I took part in our recruitment, site visits, dinners, giving tours, things like that as the imaging director. So when the recruitment position, and we also called it physician liaison position, became available, my CEO asked me to apply for it. To be honest, I was a bit surprised, as I'd always been drawn to the clinical side of healthcare and didn't really ever see myself in more of a administrative role and not taking care of patients. So I applied for the job. With his confidence, it made me consider the opportunity and ultimately led me into the field. That was 17 years ago. Lots of changes, but I haven't looked back since.
Well, and I know I have, obviously, working together at LifePoint, witnessed some of those successes, the recruitment successes you've had, and those long-term physicians and providers you've placed into those communities, definitely a rural focus, which is widely needed. And you've worked across several kind of institutions and departments and regions across the country in your roles. How have those varied experiences really shaped your approach to recruitment and retention in healthcare?
So when I began in recruitment in 2008, LifePoint Health wasn't directly employing physicians. Instead, we brought them in under recruiting agreements with income guarantees, sometimes PSAs. As the recruiter and liaison, I was deeply involved in setting up their practices from ground up. That included everything from ordering equipment to decorating the office, helping hire staff, coordinating external support like provider enrollment and billing. And I really understood early on from recruitment how important retention was, and that my role wasn't just about recruiting, it was about ensuring these physicians were positioned for success and able to ramp up their practices before that guarantee period ended.
Can you talk a little bit about, a lot of that we lump into onboarding these days, and so that overlap from finding the candidate, hosting them, and then they ultimately sign and come, and then they stay for 20 or 30 years and you go to their retirement party. Can you kind of wrap that together? Because to me, that's that full cycle recruitment piece that you've worked on over the years.
I guess it's all about building relationships, building those strong relationships with the physicians, with your CEOs, their family, and kind of being the liaison between those two. Not everyone gets along and not everyone has the same personality, but if you can be the buffer between those two, retention tends to follow.
So as someone with such a diverse training background and the clinical piece you mentioned, how have you integrated that clinical understanding to really lead from a strategic focus for that recruitment and retention?
I believe it's essential to have strong understanding of the market that you're recruiting for. That was more straightforward when I was recruiting for my local hospital, where I had a clear grasp of what we could offer and then what we needed to attract specific specialties. My clinical background gave me the ability to engage in more informed conversations with both the physicians and the corporate leadership. I had worked in the OR before. A lot of the things that they were asking for or things they were talking about, I could relate to that, not as in-depth as a physician would, but I understood what they were talking about. So it also helped me assess the needs more strategically, understanding our existing medical staff. Having a long-term succession planning in place is key to building and sustaining a strong provider network. This is also true of potential growth strategies in your markets.
So let's talk a little bit about some of the leadership lessons you've learned while building and managing teams, particularly during some challenging transitions like mergers or staffing crisis. I know some of the strategy pieces that you've mentioned, those are lessons that take time. I don't know that there's a business school that you go to, but what are some of the lessons you can share with the listeners?
I'll give a little bit of lessons back from my imaging days. I think those years really were formative in my leadership development and the way I approached leadership. So I've managed teams from varying sizes, up to 40 employees in the imaging department down to only one on all levels in between. I've learned countless leadership lessons from both exceptional mentors and from the teams that I've worked with. Probably one of the most valuable things I learned is the importance of truly understanding the roles of your team members. When I stepped into my first leadership position in imaging, I spent the first month shadowing the front office, observing how the receptionist managed the flow of the day. My thought was, she answers every question that comes into the department, and if I can even learn 10% from her, then I'm way ahead of the game. So during that time, I even transported patients for CT and MRI just to help their workload. I was blessed with an administrative team that supported me during that time, holding off on tasks like payroll, scheduling, and things like that so I could focus on learning the department. I truly believe that hands-on approach helped me earn trust and laid the foundation for my success as a leader. The department was not in a great place when I started, and I just felt like I needed to be a support for them so they could trust me and I could earn that. As far as staffing crisis, especially in clinical departments, it can be incredibly challenging. I often stayed late when needed, but I wouldn't trade those years. They taught me to be resilient. They deepened my empathy as a leader. As far as mergers, they're never easy. My advice is to stay flexible, voice concerns when operational challenges may not be effective, but if they move forward with their decisions, give them a fair chance. If they don't work, come back with a solution. I would say 2 pieces of advice from a mentor have stayed with me throughout my career. Never ask your team to do something that you wouldn't be willing to do yourself, and never bring a problem to your leader without also bringing a potential solution.
I think those are great pieces of advice. And obviously we went through some pretty significant transitions and acquisition, being acquired and merging and spinning and all the things. And I think when you're in a large national health system like we were, it is a lot of change. I mean, there's change every day in a single hospital, but I think it's more pronounced as you get into those other levels. I really like what you said about shadowing. I've talked about that with other guests. Like, that is just a huge component of, especially for recruiters who may have come from an external marketing background, but if you definitely haven't had healthcare experience in a hospital or a clinic, that time is invaluable. And you're right, to see what the very first person that interacts with the patients does to the very last. So I'm sure that you learned a lot of lessons there, and it's a lot. There is no handbook for what we do in many of these jobs. So as you go through some of the teams that you've led and then your role now, really working closely with residents and fellows in the GME aspect, how are you fostering innovation either in those recruitment strategies or other aspects of this role that you're doing, especially when you're in a traditionally structured recruitment team?
Yeah. Innovation in recruitment often means finding creative solutions within existing structures. For example, when tasked with recruiting a third neurologist at one of our hospitals, it was to help with call coverage. We were worried about the physicians, it pulling volume from our current physicians, but they really wanted that third neurologist to help with call coverage. So I proposed dividing their roles into 3 rotations, inpatient, outpatient, and then starting telemedicine. This not only made the position more attractive, but it also allowed us to extend coverage to other LifePoint facilities, maximizing their impact. Even in traditional settings, listening to both the candidate and the system's needs and being willing to rethink standard models can lead to smarter, more sustainable recruitment strategies.
I like how you focused on what were you trying to solve there, and it was the call coverage. I think you often see that with, we need another pediatrician. Okay, what's the issue? It's newborn call coverage, right, at the hospital. And a lot of outpatient peds are looking at that saying, I don't want that. Much like OBs are pulling out of some of the call and going into GYN. So trying to find what's needed from a coverage, a patient care standpoint, and then being effective with bringing that message forward for that staffing plan. So that's a great example. We all know how hard neurology is. What changes maybe have you seen within physician and provider recruitment, maybe the last 5 years? So that takes us post-COVID. And what trends do you think might define the next 5 years?
In the past 5 years, I think more physicians have been looking for better work-life balance and flexibility. I know we hear that on everything we read and listen to nowadays, whether it's physician recruitment or CEO recruitment or whatever, they want that work-life balance. Many are interested in telemedicine, part-time roles, or positions that support their lifestyle, not just the high salaries. I will say they still like those high salaries, but they're willing to give that up for more time at home with families or things they like to do. I think in the next 5 years, we'll see continued growth in virtual care and stronger focus on importance of hiring physicians who reflect the communities they serve. Patients often feel more comfortable and understood when they're treated by someone of the same background or ethnicity as they are. Recruitment strategies will need to reflect that and be more intentional and inclusive moving forward.
Mm-hmm. And I think as we look at definitely passages of bills or potential cuts in the reimbursements and the things that we're not looking forward to, but potentially happening, that will become really transparent, I think really quick on that, where those underserved folks just really struggle for us to find the clinicians to go, not just physicians, but to go to those areas and serve. So we talked about retention being very critical in the recruitment. I think you're always recruiting to retain. How did you cultivate that culture really of engagement? And it's everywhere, right? Within the community, not just the walls of the hospital or the clinic. How did you create that culture of engagement to really keep those providers in those towns and the communities you've recruited for the long term?
Yeah, I believe recruitment is about relational sales. Building strong relationships, not just with the physician, but also with their family, is key to long-term retention. I feel that if they're connected with the community from the very start, they're much more likely to stay. That connection begins with a site visit. I made it a point when I was doing site visits to involve individuals who share similar interests with the candidate. You know, it may not be anybody with a clinical background. It may be a high school basketball coach and their son plays basketball, or just find a commonality between people in your community and that physician. I would try to always host a mixer, inviting those local people to the recruitment dinner. I think it helps showcase not just the job, but also the lifestyle and the support system that they'll have outside of work. That early engagement makes a big difference in how we invest and how they feel in the community moving forward.
And as you've worked across the full provider pipeline, are there some practical ways that you've built those early relationships, maybe with medical students, residents, fellows, to really create those long-time recruitment pipelines?
Yeah, that's tricky. You need to make sure that your leadership team knows that your return on your investment of working with medical students, residents, and fellows, it's not going to be immediate. They're not going to fill a role immediately. I think that's very important as you go into recruiting and working with GME. You build early relationships with the residents and fellows. It's key, obviously, to long-term recruitment success. In my role, I make a priority to connect with them early, ideally in person. I try to host at least one event each year at each of our residency programs. These gatherings allow me to interact with them outside of the hospital setting and begin building trust. I always invite significant others so the experience feels more inclusive and respectful of their limited personal time. Usually during that visit, I regularly give talks during didactics on topics like job search, what to consider when reviewing or negotiating a contract. I keep the presentations very interactive rather than just speaking at them, creates open dialogue and keeps them more engaged, encourages honest questions. I found this kind of communication lays the foundation for strong, lasting relationships. It helps our recruiting efforts. We can't hire every resident that we have, every medical student, but even if I can help them find their job outside of LifePoint, I feel that it's been a success.
You're right. Like, we probably don't have jobs for everyone. They want to stay there in the community. We know a lot of residents end up staying where they've trained. So the key points you mentioned, it's beyond bringing them cookies or Chick-fil-A. It's really providing that education, more of a business education that we know that they're not getting when they're in training. So when you're engaging with those folks, is there different messaging in that outreach that you do compared to maybe when you were recruiting more experienced physicians? So you've mentioned they're looking for work-life balance and some other things beyond just compensation. A lot of it's focused on schedule, location, but how do you tailor that when those audiences are different? And we know generationally they are looking for far different things in their jobs.
For seasoned physicians, I think the approach is focused on understanding their professional goals and discussing how our opportunities align with their career and their lifestyle priorities. It's kind of the same for trainees, but they're at a different place in their life. They want to get out of debt quick. How can we focus their job search to help them pay off their student loans quicker? They're ready for their first job, but their family's also ready for them to make real money too. So how can we help them with that? I do start early by giving them branded information about all of our locations, our residency stipend program. I personalize a welcome letter for them so that they know I'm there, that they can reach out over their time in training. I try to do that early on. I do think the small touch has received great feedback, and so they tend to come to me for questions that they may not feel comfortable asking people locally.
And I know it's a lot of travel for you to get to those programs. Is your advice that try to get in on maybe when they're doing their new employee orientation? Is it July 1st that you go as they're starting, or do you give them a little while and then start to go out and introduce yourself to those kids?
So it's both. I do try to go in the very beginning at some locations. Our PM&R residency in Texas, they have me come and visit them in person the week of orientation. So I'm literally getting them that first week. This past week, I went and talked to medical students on their very first day. So again, we're not going to see return on that investment for 6, 7, 8 years, according to what they go to, but they have a face that they can reach out to and ask questions. So yeah, I do think that you have to start early and be available for them.
And I think that's great. I know, for PracticeLink, and you've worked with Charlie Lowry, our GME director. He has been creating those relationships with programs in and around St. Louis. And the first time he was invited to the orientation, maybe last year, but he just really enjoyed that. I mean, there's just an energy with those folks coming in and starting their programs.
I will say June and July for, I'm sure Charlie's role and mine as well, you have new residents coming in, but you also are invited to all the graduations. So you want to try to hit those too. A lot of travel in the summer months. I do try, if I can't be there in person, we do a lot of just 15-minute introduction to LifePoint via Teams or whatever. And so it's very short, informal. Hey, I sent you a backpack with my name. This is the face to that welcome letter, and I'm here for you if you need me. Things like that. So you can't be everywhere, but I definitely try to be.
Do you want to know when to do what in your job search? First Practice, PracticeLink's resident and fellow career guide, teaches you 10 easy-to-follow steps every prospective physician needs to find their dream practice. And best of all, it's completely free at firstpractice.com. Becoming a physician is hard. Finding a job doesn't have to be. Thank you for listening. Now we'll return to the podcast.
You mentioned the residency stipend. Do you have other resources that you're providing to them?
Yeah, so we have immigration talks, we have coding and billing talks that, people within LifePoint. That's the good part about being part of a big company. We have a lot of resources at LifePoint. So I try to work with those program directors and coordinators to see what their needs are. We also do Navigate Student Loans is a big company that we use to do webinars for us. Some people use it and some people don't. If you have a hospitalist or you have a program that's internal medicine that's basically hospitalist based, a lot of those people don't have high student loans. Your foreign medical grads usually don't have really high student loans. So I've even had some talks for medical schools. People that are getting ready to apply for residency, I use Navigate to talk with them about the next steps and making smart choices in those student loan options that they have.
Yeah, I think all of those are terrific resources, and we're at that time where we need to do more, not less, just the competitive nature of the job market for what they're seeing whenever they do finish training. I found this one question that someone gave to me, but it's really, you might be able to use it. I don't know. Our listeners might be able to use it, but it's if you're asking someone, what are your career goals? So think both professional and personal, and those aspirations and expectations, and really having somebody think through that, where for you, as you're talking to those folks, you'll really learn a lot about them in terms of that expectation is huge, because that's where sometimes the contract, the finances don't meet that. But I thought for recruiters, that was a really good question. Like, what are you aspiring for? But also, what are your expectations? Because we may never meet that.
I agree. And I will say that one of my very first slides on my job search talk or presentation with the residents is know what you want going into your site visit before you ever start looking for a site visit. And I list, location, compensation, what your family needs are, quite a few things. But at the very end, I put on there, but know what your deal breakers are. Is compensation a deal breaker? Is community a deal breaker? And be okay with, after you've gone through several site visits, that those deal breakers may change. Just because it's a deal breaker on day one doesn't mean after you visited 5 places that your deal breakers haven't changed, because you learn something on every site visit you go to. So I think that's valuable advice. I can see their eyes light up when I say that, because they're like, oh, I hadn't thought about that yet.
Right. And a lot of times call or the schedule end up being a pretty big deal breaker, depending on the specialty.
And it's according to where they are. If they need high student loans paid off, that call sounds good.
Right. Make some extra money for sure. So what piece of advice or multiple pieces of advice would you give somebody starting out, really in healthcare as a career? And then as you look at the pace of change, as we've talked about within healthcare, it can be really overwhelming. That may not be what people sign up to be, even at the executive space, not just as a physician. But what piece of advice would you give somebody starting out in healthcare?
Besides taking a big, deep breath, I'd encourage anyone new to healthcare, especially healthcare recruitment, to connect with other recruiters, whether through their company or organizations like AAPPR. Even if you don't have a mentor right away, simply reading discussions and comments in the chat session of those websites can help you realize you're not alone. Stay flexible and be open to new approaches, especially in a fast-changing field like healthcare recruitment.
We talked about earlier, it's not really something any of us went to school for. And so that networking becomes very, very important.
And I'll add to that, I agree. When I went to radiation therapy school, never, ever did I think I would be recruiting physicians or working with residents that I used to see when I was in radiation therapy training. But I would say that continually educate yourself, even if it's not in recruitment, in leadership or just something. Read, go to conferences, listen to podcasts, whatever, to continue to grow, because we can always learn something new every day.
And I think it helps when you're taking that active responsibility in your growth. It can help that change feel less overwhelming, because you're hearing it's not just you, it's the industry, or it's not just you when sometimes you feel it's just you.
Yeah, and to add to that, a lot of times it's reversed. I have actually been on some of the chats and listened to things, and I'm like, oh, I'm actually doing a good job there. I thought it was terrible, and I'm like, no, I'm handling that better than what I thought I was. So it can build you up, not just tear you down.
Yeah, for sure. Can you share maybe a mistake or a misstep, like early in your career, that maybe became a decisive learning moment for you?
I'm sure that I have made plenty of mistakes over the years and missteps, but the early misstep that stands out involved a fellow recruiter. I'm not going to tell you her name, but she was speaking with a candidate. We were recruiting this physician to go to both of our hospitals, which are like 20 miles apart. And so the candidate asked her, do you have a Da Vinci robot? And she confidently said, oh, yeah, if we don't, we'll get you one. Then she calls me and says, hey, what's a Da Vinci robot? And we were in a very, very rural market. And 17 years later, that hospital still does not have a Da Vinci robot or that type of technology. So it was a very valuable lesson, knowing your market thoroughly and ensuring you don't overpromise something that you can't deliver. That is the quickest way to lose respect. And it's a small world. If you lost respect with one physician, you don't know how many other physicians they may tell. So know your market, don't overpromise, and overproduce and underpromise, I guess, would be my best advice.
And we've talked about that on this podcast before, just that honesty and transparency. If, let's say, you're having to replace a whole practice or a whole specialty that changed, they walked out, but you've got to be honest with the people you're bringing in about what the challenges and difficulties are.
That is a tough part of a recruiter's job, especially if you work in that community or you're tied to the community, all the ins and outs. And again, I just don't lie to them. If you lie to them, they're going to leave and you're going to start all over. So I had rather not recruit them and be honest, but again, do it in a way that turn it positive if you can.
Yeah, absolutely. Let's shift a little bit. What's one success story or a win that stuck with you and why?
One success story that's always stuck with me involves a urologist I interviewed several years ago. At the time, he chose a much larger market over the hospital I was recruiting for. 5 years later, he calls me. His contract is coming up at where he chose to go work. He called and he said, hey, I made a mistake. I want to come work for you guys. I didn't understand what working in rural medicine was like, and that's why I chose this other place. So he signed with us. He's been with us ever since, and that's been almost 10 years ago. And what stood out to him really was the site visit experience and the attention to detail we put in making him and his family feel welcomed. I think that level of care made a lasting impression and ultimately brought him back to us. It taught me that site visits are very important. And again, being honest up front is very important.
I think what I've seen since the time we've known each other is your ability to stay connected with those folks. It's not easy. It takes time after all these years of the people you meet and interview, but really creating that connection. And you may have found out when their birthday was or their child has something. Remembering those small details and keeping those relationships alive. Obviously, you created something with this person that brought them back 5 years later.
Yeah, I have friendships with physicians that didn't choose me. They didn't choose us. There's a handful, but I still check on them from time to time, and they'll still check on me. Social media does make that easier. I wouldn't friend them on social media while I was recruiting them, but I would after they chose somewhere else. And, we get to see each other through social media and stay connected.
I think that's a good vote for how you use social media and those environments where it can be iffy with folks sometimes. Let's get out a crystal ball. And if you had the power to fix one systemic issue in healthcare recruitment, what would it be and what's your vision for getting there?
If I could fix one issue in healthcare recruitment, it would be the lack of long-term workforce planning, not just locally, but at the corporate level as well. I think too often we focus on filling immediate gaps instead of building pipelines that match our future community needs. Not just the hospital, but where's our community going? Are we growing? What are we losing and what are we needing? Maybe you should do a poll with your community and see what their needs are. You may think you know, but you might not really know what they need. I work closely with physicians in training to start building relationships early and support strategic, sustainable recruitment. When recruitment is part of a long-term plan, it's not just short-term fix, everyone benefits. The providers, the system, and most importantly, the patients in your communities.
And I know we've sat through hours and hours of strategy and getting there, and it's painful. You want the seat at the table, but it can be painful, but it's important, like you said, where you can see the vision and then you can help better plan and inform. We're starting a service line or needing to replace for retirements. It's important the recruiters are right there in those conversations.
Especially those recruiters that live in their markets, they know what works and what doesn't a lot of times. You know, if you're planning for, I don't know, infectious disease doctor at a hospital, a 100-bed hospital that you only have 40,000 people in your town, they're probably not going to be successful there. So you have to know your markets. I do think recruiters that know those markets and what they're recruiting for can bring so much value when you do have a seat at the table for people that may live hours away that are making those type of decisions.
Yeah, I think you mentioned earlier too, be creative with the staffing. May not need to be on site. In that case, for ID, they can do a lot of telework and have a trained APP there that's helping them.
Yeah, our plant have someone that drives down from a metro area that's within an hour or something like that, that offers you 1 day a week. And put that money somewhere else that it could be more successful than recruiting a doctor that's not going to have enough volume.
I think a lot of what you've talked about really provides long-term sustainable patient care. We focused on recruitment and retention thing, but the outcome there is the access within the community to whatever specialist it is or the care that they need. All right, lastly, so how do you stay grounded and inspired as a leader in such a dynamic and high-stakes field?
What keeps me grounded is remembering the impact my work has on real people, both the providers we recruit and the patients that they care for. It's easy to get caught up in the fast-paced pressure. Staying connected to the why helps me stay focused. Is professionally, why am I doing this? And it's not just for our patients, but it's also for those providers. They've invested a lot of time in their training. You know, from working with me, I tend to fight for the physicians I'm recruiting, get the best deals that I can. I'm also inspired by the relationships that we mentioned earlier over the years. Seeing a physician thrive in a community I helped them join, or watching a resident find their very first job is incredibly rewarding. Honestly, I learn as much from my colleagues and mentors as I do from any type of leadership book.
Yeah, I would agree. Those are wins that you can take with you for your lifetime because you've had that really amazing impact on the community. So on behalf of myself and PracticeLink, I want to extend a heartfelt thank you to Tina for joining me today on the Workforce Wisdom podcast. It was engaging and insightful conversation covering your leadership journey in healthcare recruitment, definitely the evolving role of technology in connecting with your candidates, and also how you champion that diversity and equity and inclusion into your hiring practices. Tina, I think you've shared some practical advice for new recruiters and your vision for improving that provider retention, which we know needs to be a focus for all of us in this industry. For our listeners, you can connect with Tina on LinkedIn to follow her work and insights in healthcare talent strategy. Don't forget to explore the additional recruitment tools and expert guidance in the PracticeLink Resource Center at www.practicelink.com. As always, we'd love to hear your thoughts, insights, or questions about today's episode. Feel free to reach out or email us at plmedia@practicelink.com. My name is Christy Bray. Thank you for tuning in to Workforce Wisdom.